What happens if you treat an autistic crisis state with medication designed for psychosis? What are the dangers there?
Because the treatments are fundamentally different, right?
Completely different. Antipsychotic medication is designed primarily to quiet down that narrative-generating function of the brain, reduce the delusions, reduce the hallucinations.
Okay.
Now, while it might temporarily dull the surface anxiety or agitation in an autistic person in crisis,
Which might look like improvement initially.
right, but it doesn't actually solve the underlying problems. It doesn't address the sensory overload or the need for structure and predictability or those lifelong communication differences.
So it's like using a chemical sledgehammer for a problem that actually needs, I don't know, architectural redesign, better supports?
That's a perfect analogy.
Yeah.
And the medications themselves can have real downsides for an autistic person. Our sources point out how antipsychotics can sometimes blunt the very things that are strength, that deep focus, those specialized interests that are often core to their identity and how they cope.
Oh, wow. Okay.
Plus, many of these meds have significant cognitive side effects, issues with movement sometimes. So you're essentially treating a neurological difference with a drug that might actually worsen their quality of life long term without ever touching the root cause. The real problem, that coping failure, it just remains unhealed. It's just papered over, leaving them vulnerable to the next crisis.
Okay, let's focus them specifically on that state, that autistic crisis state. Some researchers call it the clinical high risk for psychosis state, which sounds pretty scary.
It does sound scary, and it is a state of intense vulnerability.